Good afternoon, everyone. Thank you so much for joining us here today for another webinar with Clay Horton, the Director of Public Health, the Green River District Health Department here in Owensboro. Um, you look around the community, and times of crisis is when real leadership emerges. And if there's one thing that we've been so proud of and delighted with throughout this has been Clay Horton's leadership. Clay, thank you so much for always being there for us when I have member questions and I contact you directly. Thank you for helping our members get open and stay open safely. It's been just you've been a treasure, and we really appreciate your work. So today, Clay has agreed to come and talk to us a little bit about vaccinations and give us an update on where we are, a little background, and then we have several questions that have already been submitted from members, and he has those. And if you have questions during the time, then let us know, and we will do those as we did the last COVID-19 seminar webinar that Clay did. So with Clay, I'm going to go ahead and just hand it over to you and let you give us an update.
Thank you, Candace. I really appreciate the opportunity to meet with your members and to talk about vaccines. I know it's been a hot topic. It's been something that we've got a lot of questions on. I think our call volume at our health departments are up about 150% over over what we normally do. But everyone's eager to get vaccinated, and we're eager to vaccinate folks, both just us as the health department and our partners in the community. I think it's amazing that we had vaccines developed and released as quickly as they were. Now it's just the hard work of getting them out into the community and get them into people's arms. And the long and the short of this story is that there is just not adequate supply yet to vaccinate everyone who wants to be vaccinated. The supply chains will get there. We will get to a place where there are adequate vaccines. But right now we're getting a very small amount of vaccine, and we have a lot of people who want to be vaccinated. And so I'll talk a little bit about the priority phases and the general plan of how to get this done. I think the thing that's important for your members and people who want to be vaccinated, who want to get their workforces vaccinated, is to be somewhat patient, stay informed, keep track of changes, because there are changes and the plans and strategies evolve all of the time, and be ready to mobilize when you have that opportunity. If I can figure out how to share my screen here. Hopefully most people have seen this already, but these are our phases in Kentucky that for priority groups. And I'll just kind of go through them very, very briefly. The first phase that we started in December was 1A. These were residents of nursing homes, long-term care facilities, assisted living homes, and healthcare workers, anyone that came in contact with or providing clinical services through the healthcare sector. And that didn't just include your providers. It wasn't just doctors and nurses. It was everyone within that system. So your people at the front desk that check you in, and the environmental services folks that come in and clean rooms, and the people that transport samples to the lab, were all included in that 1A phase. And so that was the first area. In Kentucky, the long-term care facilities and the assisted living facilities were handled through partnership from the federal government with CVS and Walgreens. They're the ones providing the vaccines to those residents and workers in those facilities. And the healthcare personnel primarily came through hospitals and health departments were the vaccine providers for that. Our next phase is 1B. This is the phase that we're currently in. That included first responders, police, anyone that is called upon in a crisis and an emergency, anyone over the age of 70. And our K through 12 school personnel. And that's more than just teachers. Again, kind of like with the healthcare workers, it's the entire system. So it's all of those people that work both on the front lines and behind the scenes to make our schools operate are in that 1B category. The next phase that we'll be working into is probably where it's going to pick up a lot of your chamber members is 1C. That will pick up anyone that's over the age of 60. Anyone that has a high-risk medical condition that puts them at a greater risk for complications from COVID-19, and all essential workers. So And we've provided a kind of a brief list of who's incorporated in those essential workers. And it's a lot of folks. It's healthcare personnel, first responders, corrections, anyone working in the food and agriculture sector, manufacturing, postal service, transportation. I won't read the whole list to you, but it captures a lot of people in that 1C category. So the big question we get a lot is, when were you going to move to 1C? And do these phases overlap? And the answer to that is they do overlap. In addition to trying to follow these phases, there is an emphasis and a goal put on trying to get vaccine administered as quickly as possible. In Kentucky, our stated goal is to administer at least 90% of all the vaccine that is received at an administration site within 7 days. And so the strategy that we'll use is we'll always start with those highest priority groups, try to identify those individuals that need to be vaccinated, want to be vaccinated, that are in 1A. When that pool of people are exhausted, then we move to the next category. So we may move into 1B. You may even see in some locations when there's a lot of vaccine available, you may see some places in Kentucky that have vaccinated a few 1C folks. But with the principle being that as you move to the next week, you kind of start the queue over again, and you're looking for those folks that fall in those priority groups, those that are the ones we want to vaccinate first, and then we'll work our way through it. So currently, like I said, we are in 1B. I think that we'll probably be in 1B through the rest of this month. As we get into February, I think you will see a lot of more opportunities within the state of Kentucky to have 1C folks sign up, get an appointment to get vaccinated somewhere in one of those facilities. So as I was saying, the long and the short is that there's not enough vaccine available at this point. So we're trying to continue to work through those phases. I think you will see some opportunities and kind of on a current steady pace, people being vaccinated within the community. But as we kind of move forward, at least for the next couple of months, the demand's gonna be higher than the supply that's available. So I think we'll be in 1C starting, like I said, next month. I think that we'll continue to be in that phase all the way up to early summer. And then when we move into late summer, I think that's when we're going to start moving into that phase 2, which are your individuals that are over the age of 40 that don't fall into any of these previous categories. But I do think there's some hope. I think our vaccine levels are going to be pretty steady for the next month or 6 weeks. But there are some things on the horizon that could create more opportunities. There's a federal partnership with pharmacies that will be an additional conduit of vaccine into our state. That'll be outside of the allocation that we're already getting each week, but so people can go to their Walgreens or their Kroger or one of the places that they normally go get their flu vaccine. So what we want to see is lots of venues, lots of opportunities. We don't want the health department and the hospital to be the only games in town when it comes to vaccinating folks. If you have the opportunity to get vaccinated, we want you to get vaccinated. And then as we move into summer, I think our challenge will change a little bit. We'll get to the point where we'll have to be trying to find people that haven't sought it out on their own, and we're going to have to convince folks why they need to be vaccinated and what how that supports and helps our community and helps them individually. So there's this federal initiative with the partnership. I think you'll see that's already been initiated. I think you'll see that come online sometime the middle of next month. The Biden administration today announced their new strategies for COVID-19. I haven't had a chance to look at all of that, but from all accounts that I've read so far, they are supportive of that pharmacy partnership that's already been activated. There should be some direct federal support coming to doing mass vaccination clinics. Even without that, I think you're going to see those pop up in Kentucky. There's already planning in place where to do regional mass high throughput vaccination clinics. Those are being planned in our region. You will start seeing those announced at a state level through a partnership with Kroger starting next month. There are other things that are happening with the federal government. There's talk of activating the Defense Production Act so that the supplies of vaccine can increase. And then the big one that we're kind of waiting for too is having a third vaccine approved. So it's expected at the end of this month that Johnson & Johnson will have clinical trial data to release on their vaccine. And having another option in the marketplace is going to create more opportunities, create more supply, and take a lot of this pressure off.
So,
So,
just a logistics question. With regard to you saying that we don't have enough, does that mean that not enough has been made, or that Kentucky hasn't received what they? Can you kind of let me know? Is it so? There's not just vaccines sitting around, and we aren't getting them in Owensboro.
right. So it's not available. It hasn't been produced. It's being distributed as quickly as it's being produced. There was a story that ran on CNN. I don't know if it was yesterday or the day before, that kind of ranked the states in terms of how quickly they were rolling out their vaccine. And Kentucky was one of the higher ranked states in the country. So,
Very good.
our problem is not a capacity issue to administer the vaccine. I think that within the state, we have a lot of capacity to administer more vaccine if we had the vaccine available. So there's not a big stockpile of vaccine waiting somewhere for us. It's being shipped out weekly for the state right now. It's about 54,000 doses. There's a stated goal of trying to distribute that within the state proportionate to population. So, Green River District Health Department, our 7 counties here, is 4.8% of the state's population. So if you do that math, if the vaccine level stays steady, we expect about 2,500 doses in our 7 counties. Davis County, being our largest county, is roughly half of that. So I think our hospital partners could administer more if they had the vaccine. Here at the health department, we could administer more if we had the vaccine. And I get calls and emails every day from pharmacists and federally qualified health centers, private offices, providers. Everybody's chomping at the bit to administer vaccines. So there's a lot of capacity there. It's just we have to wait for the supply to catch up with us.
It's good to know the capacities there. That's very positive. Thank you.
You're welcome. So had a few pre-submitted questions, and I'll just kind of run through those. It said, approximately when would shelter employees be eligible to receive vaccine? I'm assuming that maybe like homeless shelters, people that are providing maybe counseling or other, rehab services to their clients. I think employees in that setting would fit in 1A. So they would be eligible now if you submitted that question and your organization employs people doing those type of services. Reach out to us at the health department. If you go to healthdepartment.org, that is our website. There's an avenue there to register your organization if you fall within that 1A category. Right now, we've administered all the vaccine that we have, but as we get more, we'll be reaching out to those partners and offering that. Timing for 1C, and is there any chance of overlap between 1B? Yes, there will be overlap between the groups, and I think timing for 1C is soon. I think next month is when you'll start seeing those opportunities for folks in the 1C category to get vaccinated. But again, it'll be a long time before we have enough vaccine for everyone that wants it. So we'll be in that 1C phase for a number of months. So not everybody will be able to go on day one. But there will be those opportunities there. The question was, how are vaccinations for essential workers, phase 1C, working with a single company, planned to be scheduled and administered? So right now, I think as long as there's a scarcity of vaccine supply, we'll be offering opportunities for folks to sign up and get vaccine that fall into those categories more with the general public. There may be opportunities down the road for businesses to partner with someone like a pharmacy or a health department, or maybe even the hospital to provide vaccine for their workforce. But again, I don't think that's going to be something that's going to be a big option until the supply catches up. We have been keeping a list or a queue of organizations that have contacted us here at the health department that fall in that 1C category. I think we're still continuing to take those names and numbers. But again, I think that we're a ways off for where that's really going to be a possibility until there are more venues, more opportunities, pharmacies, other providers that are going to have access to vaccine. A person asked about long and short-term side effects of the vaccine. I don't know that we have a lot of information on if there or any indication that there are long-term side effects. These vaccines are safe. There's 2 that have been approved by the FDA that they have, administered clinical trials and determined that they're highly effective and they are safe. In terms of short-term side effects, the side effects that we're seeing are very similar to other vaccines that you administer. Sometimes people will complain about a sore arm for a couple of days, and in fact, that's probably the most common complaint. Or you may have a low-grade fever. Those are fairly rare, but they're just a natural process of your immune system kind of kicking in that causes that. You have seen a little bit of news coverage about very few people are having allergic reactions to these vaccines. So, that's something that we're cautious about when we do our vaccination clinics. There's a 15-minute waiting period that we want to make sure that, after it's administered, that everybody's doing okay before we release. So, just, the types of side effects that we're seeing are very typical of what you would see with other vaccines. They're relatively minor. And I can't emphasize enough that all the data that we have suggests that these vaccines are very safe. Someone submitted a question wanting to know if a company could require employees to get vaccine. Not an employment lawyer, so I'll probably leave the final answer to someone's got a little bit more expertise on human resources there. I would think that currently, probably you could. There's some precedents there. Some employers require employees to get flu vaccine, or I know that in our workforce, if it's employees that work with bloodborne pathogens, we vaccinate them for hepatitis B and hepatitis A. So there probably is some precedence there in terms of how you structure those policies. Probably need somebody that specializes that a little bit more than I do. I do know that in the state legislature, there's about a half dozen bills that have been filed prohibiting that. So currently, I'm not sure of anything that legally says that you can't, but that is something that's a concern of folks, and we have seen some legislation filed for that. Someone asked which vaccine is more effective, the Pfizer or the Moderna, and how do you get Pfizer vaccine? So I think the data, the effectiveness on both of those vaccines are very similar to each other. Both of those vaccines are being administered in our community. The hospital has administered both Moderna and Pfizer. Health department here and our federally qualified health center that has a vaccine in Davis County have both had Moderna. I'd say that at this point, you're not going to be able to be very choosy about picking between this two. If you have an opportunity to take one or the other, I would suggest that you take that. And then I guess the final question is a COVID compliance officer asked, do we believe we'll have enough access to vaccines in our community to hold a festival? And I think at some point we'll get back to having festivals and seeing semblance of some normalcy. It's going to be a while though, even with vaccine being rolled out. We're still going to have to take other precautions. We're still going to have to do these other things that we've been doing to try to control the spread of COVID-19 in our community. And it will take a little bit of time to get there. So that's probably more of a long-term goal than something that we're going to see, coming through this winter and maybe by the time summer gets here, there'll be a little bit more opportunity depending on what the level of spread and what kind of progress we're making as a community.
So Clay, I've been received several questions while you've been speaking, and one person asked if you would. They said they knew several people who had gotten the vaccine and then said, okay, tomorrow, and the next day they went out and started doing stuff and not being cautious, and the person asked, is that, how long does it have to take effect, and is that smart to do that?
It's not smart to do that. We would still encourage you to be cautious and practice other measures and other steps to control the spread of vaccine, or the spread
And that
control the
I'm
spread of
sorry,
COVID.
and that was the first shot. That was their first shot.
Yeah.
Yeah.
So there is going to be a period of weeks before you develop full immunity. There is some data that suggests that the vaccines are effective after the first shot. It takes about 7 to 14 days before you start seeing that effectiveness at all, that you're giving some protection. But your peak immunity is actually going to come 2 weeks after the boost dose. If you're take a Moderna vaccine, your first dose, 28 days later is when you get your boost dose. So then a couple of weeks after that. So you're looking at 6 weeks before you have your peak immunity. The other concern that we have is the clinical studies that were done on these vaccines looked at if they prevented illness. They looked at if they prevented you from developing symptoms, and especially if you develop severe symptoms. And that's how their effectiveness was measured. So it's still not clear if they completely prevent you from getting infected, or if they just prevent you from getting sick. So there's a possibility that you could be infected, still spread that to someone else, but not feel the effects of it yourself. So until that question's answered, it's still important that we all continue to wear our mask when we're around other people. We're practicing social distancing. We're just being smart in general.
Thank you. That had actually been another question that popped up: is, do I have to wear a mask after my second shot? And you just answered the question. The answer is yes.
For a period of time, we will. Once we move society past the point where we have a lot of immunity among our community, perhaps we won't have to wear a mask all of the time, but it's going to be a little while, and we're still going to have to kind of stick with those commitments.
And the other, the other side of that is, if people don't and they've had their second, well, then other people might stop, and then you kind of end up having an unraveling, just because there's confusion.
That's correct. Yeah.
Okay, let's see. Can you expand on who would fall under the finance category of essential workers?
Yeah, so I think that would be anyone that works, in banking, the trying to keep the economy going. I don't, if you go to covid19.ky.gov, there's a lot of information on vaccine, and I believe there is even some, maybe not an exhaustive list of examples, but there are lists of examples of folks that fall into these various categories. And let me see if I can look here real quick and see if finance is expanded on that. Finance is not expanded on that. So I think that we would probably trust those industries to identify what is finance and what is not. So, if there are questions, they can call us here at the health department. Maybe we can parse through that a little bit.
Yeah, and it seems like that might be more like a bank teller, because that person has like very regular contact with people, and
I think without question it would include a bank teller. I just don't.
An auditor, that might not be around, that might be more secluded in nature of what their job is.
So, all right.
Okay, we have several more. Let's see. Do we know how long the vaccine will prevent illness?
We don't know that yet. So we'll have to wait till these have been used for a little bit longer. We hope that you're able to get a long-term immunity from these vaccines. And so that question is yet to be answered. But we're hopeful that immunity will last for some time.
Okay. So, and back to the shelter question, will homeless shelter guests fall under different categories while staying at congregate shelters, or they follow usual phases?
So I think if you're in a congregate setting like a shelter, that's definitely in 1C. Those are your vulnerable populations. Those are things that we have. Those type of folks, those populations are things that are on our radar here at the health department. And as we see vaccine more widely available in the community, that where people have other venues to go, I think that's going to be where we put a lot of our effort, is seeking out those individuals that will have issues accessing vaccine other ways. Things like homeless shelters, jails, places that we have a high risk of spread. We will give them priority.
Okay. Is there a reason why someone should wait 90 days to get the vaccine if they've had a mild case of COVID?
So the official guidelines is we offer it to anyone as long as they're not having an acute infection. If you have been recently infected in the last 90 days, there could be the opportunity for you to have increased side effects just because that your immune system is already kind of recognizes the virus or the spike protein on the virus. But I'd say talk to your healthcare provider about that. Make your decision. There's nothing that would preclude you from taking it early, but there perhaps is some line of thought that it may be better to wait that 90 days. Again, that's just a decision each individual will have to make.
Okay. And if someone's already tested positive for COVID and they had it, do they still need to get vaccinated?
Yes, there is data that suggests that the vaccine actually produces a stronger immunity response than just being naturally infected. We are seeing reinfections. We're seeing folks that had COVID-19 back in the spring and now are coming up positive again. So CDC thinks that immunity from natural infection lasts 3 or 4 months. 90 days is kind of their guideline for where we determine whether it's a new case or not. So yes, would encourage everyone to get vaccinated whether you've had COVID-19 previously or not.
Okay, thank you. And for nonprofits, and this is probably the question. There's probably another question for this person who's asked this question. What phase do nonprofits and social service organizations fall into?
Probably 1C, depending on which organization they work for. When I see social service organizations, if they're people that are providing direct, personal services to individuals, it may even be 1A. So
Shelters are nonprofits. Shelters are social service organizations.
Yeah.
They're absolutely. It would
So I think it just depends on what you're doing. That's all. Okay, go ahead.
Are janitorial staff included in 1B?
Well, if like janitorial staff for like a healthcare organization would be 1A actually. 1B, I think it would depend on where they're working and what they're doing. Probably most things are going to be 1C, but if they're working like in a first responder agency, we're not carving out different roles and responsibilities within those organizations. They may be included in 1B. 1C, it's just going to depend on where they work.
And obviously, if they're a school employee, then they're
1B. Yes, yeah, that's a good point. So,
one person has asked, what would the cost be to employees who want the vaccine? Does insurance cover it?
So right now, all of the vaccine that's being administered everywhere is paid for by the federal government. So there is no charge or fee associated with the vaccine itself. Everyone that's administering does bill insurance, and insurance pays a small fee for the administration of the vaccine, but there's no out-of-pocket cost to anyone. So if your insurance policy doesn't cover it, most of them do. We don't bill a patient. We don't bill the employer if we're working through an organization. If insurance pays, then we bill that, but otherwise there's no cost to any individual or any employment agency.
Okay, thanks. So on a given week, do we know how many vaccinations are coming? Do you know, are you getting the same amount as Owensboro Health, or do you all just find out as they become available from the state, then you find out what you're going to get?
Yeah, so that's really been a big challenge. And up to this point, it's not been steady and it's not been predictable. Some of the early shipments, some of the early allocations of the state were bigger than what we've been continuing to get. So right now, here at the health department, we're not really receiving any vaccine for the next couple of weeks, except for vaccine for boost doses. And that's because so much of the Kentucky allocation is being directed towards the K through 12 for these next couple of weeks. The hospital is continuing to get some vaccine from 1A. I'm not sure exactly how much, but I know that they have they know what their allocation is, and they're planning accordingly to that. But I can assure you that I know that everyone is trying to meet this goal of administering at least 90% of what they receive within 7 days. So no one's sitting on vaccine.
That's
Um,
ambitious.
yeah, but it does vary. I'm hopeful that as we get into February, once we have the folks in the K through 12 community have had their opportunity to get vaccinated, that what we will see is maybe a more predictable or steady supply, and that'll make it easier to plan and make arrangements for everybody that's doing this type of work.
So Clay, you'd mentioned the K-12 personnel. Can you tell us what the plan is right now on the K-12 vaccinations for the personnel?
Sure. So in Davis County, the school systems, both private and public, are working with Walmart. So as the state set up this program to offer vaccine through all the K through 12 folks, there were really three options. They were working with either Walmart, Kroger, or in some cases health departments here at the Green River District, so that we weren't slowing anyone down as we try to do 7 counties simultaneously. We focused at the health department on those counties that didn't have access to a Walmart or a Kroger, and then talked to our school districts in those areas that had access to those partners. And in Davis County, the decision was made that they're going to work through Walmart, and so that's in motion. I know planning. I've not been directly involved in that since that assignment's been made, but that planning is taking place, and those arrangements are being made, and those individuals in our community will be getting vaccinated very soon.
Okay, thank you. And this is probably for me and you both, but someone asked if people would be if agencies will be notified when they can sign up for vaccines, or is there somewhere we can go check? This person had no idea that we were locally in phase 1B. And do you want to answer that, or do you want me to answer it after you answer it?
Sure. I mean, there are a couple of things. So check frequently the health department's website. Check frequently Owensboro Health's website for those opportunities to sign up. Owensboro Health was taking appointments for 1B. I think they have booked fairly far out now, and so they're waiting to make sure that they're going to have the supply before they take additional appointments. If you fall in that 1A category, you should be able to reach out to either the hospital or us at the health department. If you go to our health department website, healthdepartment.org, there's a place that you can register if you're a 1A organization, and we'll follow up with you to do that planning. And then kycovid19.ky.gov. Watch that for frequent updates as we see these regional high volume drive-through clinics being set up. Those will be promoted there. They will be announced there. And I, you just have to stay tuned and stay informed. But those are the really good places. There are probably others that are filtering this information. I know we've been talking to United Way. They're helping with carrying some of this information out as well. And I'm sure organizations like yours are probably passing that information along.
Yeah, we're doing that. So whoever asked that question, it said anonymous. So whoever asked that, I've actually been sending out the timeframes and the emails regularly to our membership. So if you got the email about this webinar, then you've received notifications from us as well, and we will continue to do that because we know how important it is to our members to be able to do business. Okay, I think that's all the questions that we have. Clay, thank you so much for your time. I know how busy you are right now, and we probably will have you back soon for more updates. But thank you today, and thanks to everybody who's joined. We have a great crowd with us today, and we're just glad to be able to help connect you guys to resources that help you out. And I hope you have a great rest of the day and enjoy the sunshine a little bit.